Legislative Audit Commission will come to order. This is a full commission meeting. I expect we'll have some other members coming shortly to hear the release of the Special Review Department of Human Services payments for self-administered opioid treatment medication. This being a Legislative Audit Commission meeting, it's a little different than a committee meeting. We do not take public testimony, but we will have presentations from the Legislative Auditor, the staff, the Department of Human Services, and tribal representatives. So with that, Mr. Nobles.
Thank you, Mr. Chair and members of the Legislative Audit Commission. And for the record, for those in the audience, I'm Jim Nobles, Legislative Auditor. I would like to introduce the other members of the team that worked on this special review. Elizabeth Stowicki, Legal Counsel at OLA, Joel Alter, Director of Special Reviews, and Valerie Bombach, who is an Audit Director in the Financial Audit Division. Well, Mr. Chair and members, what are we here to talk about? We're here to talk about something that most of us are pretty familiar with. It's something that at least happens in my life every day. I go to the medicine cabinet, I pull out one of my prescription medications, I pour one in my hand, I get some water, and I take a drink of water. I take my tablet. Mine's for, well, I shouldn't even tell you what I'm taking medication for, right? What we're here to talk about is the fact that normally my insurance company would have paid for this prescription, bottle of prescription medication, and my visit to the doctor, but it wouldn't have paid every time I opened the medicine cabinet and took one of these tablets. But the problem we have, and the reason we conducted this special review, is that for a number of years, the Minnesota Department of Human Services has been paying the White Earth Nation and the Leech Lake Band of Ojibways for the clients that are clients of their opioid addiction treatment programs, for those clients to self-administer medications. In fact, the Department of Human Services has paid a significant amount of money every time a client self-administered medication. They paid what is known as the encounter rate, and we can talk about exactly what that is, but I think what's important to say now is that it's $455 currently in this year. So every time someone would take this from the medicine cabinet, take a pill out, and take that pill, the Department of Human Services was paying $455 because they were using what is known as the encounter rate. Now, typically, and we're going to talk about this, by law, by policy, you really only pay that encounter rate if there has been an encounter. That is an interaction between the client and the healthcare provider. But when someone takes this out of their medicine cabinet and self-administers medication, there is no direct interaction between the client and a medical provider. So how did this happen? Well, DHS, over a number of years, has been paying this, and they told the tribes, White Earth and Leech Lake, that they could receive this encounter payment for the self-administration of opioid treatment medication. So that was the instruction that the department gave the tribes. Over a number of years, these payments have been made. But last February, a question arose from Red Lake Nation. They too wanted to know whether or not they could receive the encounter payment for self-administration of medication. And again, the person in the department who typically was answering those kinds of questions said yes. But there was somebody else in the department who looked at that and said, I don't think so. And that really triggered a fury of meetings and emails within the department. And the department decided that no, we cannot pay the encounter rate for a client to self-administer opioid treatment medication because it does not involve an encounter. Now, it took the Department of Human Services quite a while to inform Red Lake and the Leech Lake Band and the White Earth Nation. They didn't tell them that until the 1st of May. in 2019. In fact, the department continued to make the payments to White Earth and Leech Lake, even though the department had decided internally that making those payments was not in compliance with legal requirements. So they told the tribes, not only are we not going to make these payments, but in August, they informed the tribes, you have to pay us back all of the payments that we have given you because we shouldn't have given them to you under the legal requirements, although we did. And so we believe that that kind of communication that came rather late and for a variety of other reasons was really not respectful of the tribes. And frankly, the relationship between the state and the tribes has been really hurt because of this dysfunction within the Department of Human Services. So that's the problem that we have. What was our conclusion about what caused this? Well, as I said, we think it really resulted from dysfunction at the department. The department did not have the authority to make the payments. The department didn't really even have a policy rationale, much less a law. They didn't have a policy rationale when we asked them after the fact, why did you do this? They had no justification. And they also had no documentation of whoever made the decision. This decision goes back a number of years, and it's been going on for a number of years. But the department has no documentation of who made the decision. We do know who instructed the tribes. We have emails of those instructions. But when we ask people in the department, but who made the decision, not just who communicated the information, they said, we don't know. And then when we interviewed a half a dozen people from the department, under oath, we asked repeatedly, who made the decision? And again, they said, we don't know, and no one took responsibility. So even though somebody made a decision which was contrary to the legal requirement, the department could have stopped those payments if they had had adequate controls, but they did not. In fact, there are layers and layers of management supervision within this unit that made these payments that failed to raise questions. They simply said, this is what we've been doing for a number of years, and no one stopped it. So the payments continued until, as I said, earlier this year in February, an outside inquiry raised the issue and really kicked off an internal review that resulted in the department deciding that they cannot make the payments and that the tribes have to pay the money back. So you can imagine that this has really created a serious financial and legal problem, not only for the state, but also for the White Earth Nation and the Leech Lake Band of Ojibwe. Resolving this is going to be extremely difficult. It could end up in litigation. It is possible that this issue will come before you, the legislature, in the 2020 legislative session to find some resolution. But it could, as I say, end up in rather complex and contentious litigation because the tribes are going to have a right of appeal. They can first appeal to an administrative law judge under a contested case hearing. And if that doesn't resolve the issue for the tribes, they can take the issue to court. So what do we recommend? Well, first of all, we recommend that the legislature mandate that the Department of Human Services establish internal controls that are adequate so that this kind of thing does not ever happen again. Now, we typically do not make a recommendation directing or asking the legislature to do this kind of directive to the commissioner. But we think that the dysfunction, the lack of controls were so egregious that really you need to mandate this. Now, I've met with Commissioner Harpstead, and she assures me, and in fact has shown me, that she has already started to design and implement the kind of comprehensive system that we are recommending. In fact, I would just say at this point, if you look at the commissioner's letter, the commissioner, and she's here to speak for herself, but she agrees that this responsibility for this situation really rests with the department. We do have two other recommendations for the legislature. We recommend that you clarify the law about the department's authority to even pay for self-administered medication when a client takes that medication away from the clinic at home. The reason we make this recommendation is because this all started before the payments were being made to the tribes. In fact, payments are still being made to opioid treatment programs that are operated by non-tribal facilities. So back somewhere, somebody in the Department of Human Services decided that the department would pay opioid treatment providers for self-administered medication. It was later that someone somewhere in the department decided that they would also pay the encounter rate to the tribal providers. Now, the department has stopped the payments, as I said, to the tribes, but the payments to the non-tribes, non-tribal opioid treatment providers, to our understanding, continues, and without any authority for those payments to be made, other than a commissioner does have broad authority to set rates for reimbursement. But we think this is so out of the norm, this is so unusual, that the government or an insurance company would pay for a client to self-administer medication at home, that this really calls on the legislature to weigh into this issue and for you to decide whether or not that's something you think should occur or not.
Mr. Nobles, we have a couple questions. First, are you referencing on page 11 the chain of the chronology? And then I think Senator Kiffmeyer has a question. Senator Rest, did you have a question?
My question, Mr. Nobles, since the department has stopped payments to the tribes in particular, why not stop the payments to the non-tribes as well? It seems unfair that you would only do stopping payment for the non-tribes on this kind of basis and yet continue to the non-tribal. Can you explain at all, is there any rationale for justifying continuing one and discontinuing the other?
Mr. Nobles.
Mr. Chair and Senator Kiffmeyer, I cannot explain that. I would agree that if there is no legal basis now, according to the department, for paying the tribes, I don't understand what the legal basis is for paying the non-tribes. You'll have to ask them. Now, it is a significantly smaller amount that is paid, and I need to make that clear. It's been in the range of $22, $23 over the times that it's been paid that we're aware of. That's in great contrast to the dollar amount of $455. But still, it's a question of whether or not those payments to the non-tribes are legally authorized. And we don't see that authorization other than the commissioner's authority to set rates for reimbursement for medical services. And again, as I say, this is so unusual to pay for that, which is not a direct encounter with a health provider, that we think it's a policy question that really should be addressed by the legislature.
Senator Kiffmeyer.
Yeah, thank you. Thank you, Mr. Nobles. And I appreciate the legislative may take possible action. I'm just dealing with right now.
Yes.
I mean, if they can make a decision right now and make a statement in regards to the tribes, it just does not make sense that they couldn't also make the decision for everybody and not just selectively say we're not going to pay the tribes. No matter the dollar amount, I understand the difference between 400 some and 24. I understand that, but I think it's just the principle. And if they have stated the one in this situation, it seems it should apply to all. whether or not the legislature takes any action is not the issue. It always kind of makes me wonder if they fail to comply or follow current law, how will making a new law improve it? The issue is more of directing our efforts towards the fact that you didn't have the authority to do so begin with. You acknowledge that, so go ahead and implement, but do it for everybody, not just the tribes.
Mr. Nobles.
Well, and Mr. Chair and members, I would remind you that the payments to the non-tribes were sort of the beginning, the origins of where we are today with the issue we have before you. And in fact, it's interesting to recall that when we talk to people about why the origins, why then pay the tribes, the only justification we got was that there was an individual who was there at the time who felt like there should be parity, as it was called, between paying the non-tribal providers and the tribal providers. Even though the dollar amounts are significantly different, the policy, which he felt, is kind of what you're saying, Senator, and that is you should treat both non-tribal and tribal the same. That was at least what he said was the idea. And we asked him, well, then, did you authorize the encounter rate for the tribes? And he said, no, I wasn't really involved with that. I only wanted there to be parity between the non-tribes and the tribes. So I think you raise a very good point. The commissioners here, you will notice on the very last page of the report, the commissioner has responded to our recommendation. It is the one recommendation that the department disagrees with, and it is because they've already stopped the payments to the tribes, so they don't think legislation is necessary. And the commissioner said that the department will review the payments to the non-tribes as a matter of policy. So the commissioner's here. I'm sure she'll be happy to address your question and your concern in greater detail.
Thank you, Mr. Nobles. Thank you, Mr. Chairman.
We have Representative Liebling and then Senator Klein, and just where you're referencing is on page 11, the chronology of who authorized what, when. Is that correct?
Mr. Chairman, and again, would you just repeat your question? I'm on page 11.
It talks about a April 19th memo, and then it references no DHS official interviewed, acknowledged making, and then it goes back to 2001 and 2004, perhaps in place since the 1990s. Is that, when you're saying some years, is that what you're talking about? Are we talking?
That's as close as we could get, Mr. Chairman. Without any documentation, we couldn't be more precise. So yes, that's the chronology as best we could put it together.
Representative Liebling.
Thank you, Mr. Chair, and I don't know if Mr. Nobles had finished or if we kind of jumped in. Maybe I should hold my question. I thought that Senator Kittmeyer had a very good line of questioning there. But were you finished, Mr. Nobles, or did you want to wrap up?
With that question, we have one more recommendation if you want me to go through that, and whatever's your pleasure.
Maybe I didn't want to pull us off course, so maybe I'll just hold my question until you get through.
We'll get back on course. So.
Mr. Chairman and members, this is really what is going to confront you, I think, in the next legislative session, unless there's some other resolution, and that is there is an existing law, and we cover this quite thoroughly in finding 6. Mr. Wiki did a significant amount of legal analysis of what is the legal situation that we face now as a state. And as you will see when you read that, there is a law that says the Department of Human Services has to recover inappropriate payments, unauthorized payments, overpayments. So the law requires the Commissioner of Human Services to tell White Earth and Leech Lake, you have to pay us the money back. And again, it would be approximately $14.5 million for each of the tribes, 29 total. So that's the current law. We think that law was enacted probably for some good reasons, and that is there are times when there are overpayments, inappropriate payments, and even when the department has made a mistake. And in fact, the law says that the payments that were made inappropriately have to be repaid, even if they resulted from a DHS mistake or error. Even an egregious one could say, well, we're not blaming the department, we got to get the money back from the people who received the payments. You know, we can understand that in circumstances where maybe the department, and this happens, sent out a double payment. And so they contact the vendor and say, you know, we owed you $10,000, we sent you 2 checks, send us 1 back. So, you know, there's reason for that law. But we just think that the dysfunction within the department that resulted in these, what are referred to as overpayments or unauthorized payments, it has to be taken into consideration. And it undoubtedly will be taken into consideration if this goes to litigation. But we recommend that you, as you proceed to consider this issue, consider a possible resolution, and if you think you want, as a legislature with the administration, to resolve this short of litigation, you're going to have to address this issue in the law, which really forces the department's hand to get the money back from the tribes. So, Mr. Chairman, with that, I am finished. I'd be happy to take any questions.
Thank you, Mr. Chair, and I'm really interested in the fact that this is something that was really going on for a long time. And since we are the Legislative Audit Commission, and I, in a different role, will be looking more closely at the role that DHS has played, and I'm sure with a lot of my colleagues will be looking closely at that. But I'm really interested in the legislative audit, the OLA's interaction here. And I know I even mentioned this to you on the phone, Mr. Nobles, when you had given me a briefing on the report. So I'm aware that the legislative auditor audits the Department of Human Services, I think, annually, and does a really comprehensive audit, and has been doing that for, I think, many, many years under federal rules. We've talked about this. A lot of federal money flows through the department, and this is one of the functions of the legislative auditor. And so while I certainly think that DHS should have proper controls and should do a lot of the things that you recommend here, I also am wondering how the legislative auditor missed this over apparently many, many years, because as you began your presentation, it seems like really a no-brainer. I can't think of any other area of anything we pay for where we actually pay a provider when the patient does something where the provider isn't even there. I just can't even think of anything where that would be true. Certainly the way you described it, you know, I take my pill, you know, we pay for the provider to prescribe that pill. We pay for the pharmacy to dispense it. We don't pay anybody when the patient takes it. So how that has gone on for a very long time, I don't know if maybe the auditor doesn't do an audit that would pick up something like that, or, you know, maybe there are changes, because frankly, although this is a very serious issue, I think there are many, many complex transactions that the Department of Human Services does all the time. And a lot of money flows through the department, a lot of state money, a lot of federal money. And this is really one mistake. It's a costly mistake, but it's, there doesn't seem to be any malfeasance involved. Nobody is on the take here, even though one wonders how you could make that kind of mistake. Does seem to be kind of an honest, ongoing mistake that a lot of people didn't catch. So I'm really wondering about the auditor's role in this, because it did go on for a very long time.
And Mr. Chair and Representative Liebling, I think it's a very good question, and a question that I've asked myself over and over again since we found out that these payments were being made and they weren't authorized. And they do stand out. I mean, and I wish I could have been here 2 years ago, 3 years ago, 4 years ago, having discovered this by our audits. We didn't. So, I mean, you can add us to the list of people who maybe didn't fully satisfy what we should have done. I can tell you that we do audit DHS a lot. We're mandated under federal law because there is a lot of federal money there. I would characterize, and I mean no offense to the hardworking auditors, some of whom are in the audience, they go over, in fact, we're over there now at the Department of Human Services doing what is called the single audit. That's the name the federal government gives it. And we go through, at the direction of the federal government, they lay out exactly what we audit, how we do that, the tests we have to require, not only at the Department of Human Services, but at other departments, Department of Commerce, Department of Transportation, where the big recipients of federal money are. The federal government says, go and audit these things. I would say to you, and this is not defending the fact that we didn't find it, that audit, given the enormity of the Department of Human Services, but it also covers the rest of the state government, it is broad, but it is thin. I wish we could go deeper. That's why I am a great proponent in our office of, after we have finished the single audit, spending a lot of resources on behalf of the federal government at DHS and other departments, that we go back and we don't take a broad look, but we take a deep look. We take one program, one set of activities, and that we go deep down into the policies, the payments, at that deep level. Let me again just sort of illustrate where this is. And I put this together partly for my own sake, but I've used it to illustrate kind of the organizational arrangement where some of this occurred. This is a vertical chain of command chart of the Department of Human Services. And this is where this happened, down here. And the individual who is referenced in our report as the person who gave the direction to the tribes is down here at the very bottom. I wish he had come forth. I wished others all along this chain of command had come forth at some point and said, you know, Mr. Nobles, I think we're making a payment that we aren't authorized to pay. They did not, but that does not absolve the Office of Legislative Auditor from making every effort possible to find what is going on at the deepest reaches of the Department of Human Services. In fact, I've asked myself, since we've done this one, what else is going on in that department that we need to look deeper at? What's going on over in disability services, which is way over somewhere else? Is this same kind of dysfunction there? Is this same kind of making payments without authority there? I can't sit here and tell you that I know, because we haven't gone that deep within the department. We've done these audits over the years, but they are not, unfortunately, necessarily designed in such a way that it will uncover something like this. One other thing I would say, it's only been since, as I recall, 2014, that the department established a claim form that the tribes had to use to note where the medication was taken. So in the past, there was no documentation that this payment was for a self-administered medication. So if you looked at that payment and it was $455, you wouldn't know whether there was an encounter or not. So there was no audit trail to follow. In 2014, to the department's credit, they created an audit trail where they required the tribes to declare, and the tribes did disclose. So there was no deception on the part of the tribes. They said in the claim form, this is a self-administered medication at home. Now, if the department had designed its controls to follow its policy and its payment form, those payments then would have not been made, because the payment system would have said, the claim says at home. We don't pay for at home. But of course, they had been paying for at home, so nobody decided, well, we better put a control in the payment system to not allow that. There was an opportunity at that point, but they didn't do it. So, Representative Liebling, I think your question is right on the mark, and it's something I think we need to, as a commission, as an office, we need to think hard, too, about how we can do a better job of uncovering other things that might be going on that we're not right now aware of.
Representative Liebling.
Thank you, Mr. Chair, and thank you for that, Mr. Nobles. And I just want to say, I believe there's a difference between a mistake and dysfunction, right? So there clearly was a mistake here, a very long-standing one and a pretty expensive one. And there's some dysfunction, but I don't think so. Those are the same things. And one of the things that does concern me, and I appreciate what you said, there are a lot of, I don't know how many thousands of decisions get made about payments. There are a lot of different things that get paid for under a lot of different conditions under our system. But you say in the report that DHS did not have controls to stop the payments, and one of your recommendations is, the first one, is that the legislature should require the department to design and implement a comprehensive system of documented management reviews and approvals, et cetera. And so this implies that we haven't had anything like this. And so that really does make me wonder why the OLA never said so, never said, hey, you don't have a proper management system. Because we can't expect the OLA to catch every little mistake either. I mean, this is, you know, everybody tries their best and you just hope that you can, you know, that you don't make any mistakes, you know, knowing as human beings that we always will. But the fact that we don't have a proper system in this enormous agency with these billions of dollars in payments, and that the OLA has never pointed that out, is really troubling to me. And I would have to say that I think that is also a dysfunction.
And, Mr. Chair and
Mr. Nobles.
Representative Liebling, I take your point. I accept it. I think it's criticism that is due us as well. As much time and resources as we spend there, I think we should have noticed this lack of controls in this area. It was very enlightening, frankly, to us, and I guess we, too, will learn our lesson from this investigation, this special review. One of the things I would note that comes to mind, that one of the ways that I think we uncovered and characterized it as dysfunction is that when we conduct a special review, when we conduct an investigation, we do in-depth interviews. We did over 24 interviews with all of the officials in this chain of command. Normally in an audit, we would not do that. We do not put people under oath for 1 hour, 2 hour, 2.5 hour interviews. I'm sure some of them consider them interrogations. But in that process of doing this kind of review, which we do not do in audits, we discovered, for example, that the director of the state's Medicaid program told us, you know, there are people over here in behavioral health who set their own rates, and we have been told to stay out of their business. We do not have a mechanism of saying, wait a minute, that rate that you've set does not comply with Medicaid standards. I never knew that within the organizational structure of DHS, that the management of DHS would tell the director of the Medicaid program, stay out of other people's business. And that's why we make the recommendation that we make. And so, did we know from audits that this level of dysfunction occurred? No, we didn't, because we hadn't conducted those kinds of in-depth investigations from the deputy commissioner, former deputy commissioner, down through assistant commissioners, directors. We made some assumptions, frankly, that we probably should not have made. We should have put on more of our audit skeptic hat and really spent more time with some of these people and maybe put some of them under oath, even in audits, in interviews. I mean, this little slice, and it is a little slice, into DHS. You know how enormous DHS is, Representative Liebling. This is a small slice. This took us these 4 people, about what, 4 or 5 months, working virtually every day on this investigation. We typically don't have that kind of time, those kinds of resources to dedicate. But we did it in this case because we thought it was a very serious concern. Not only because it's $29 million, but because of the situation that it has created for the tribes.
Representative Liebling, a quick follow-up, and then Senator Klein, and then Senator Cram.
Yeah, thank you, Mr. Chair, for your indulgence. So a couple things. One is that, one thing I think, absolutely, we would never expect the OLA to be able to do this in-depth on every single thing where there's no reason to think there's a problem. But the fact that there wasn't a system in place is really troubling, and that DHS didn't realize that. That's number one. The other thing I just wanted to point out from your table on page 8, where you list how many patients who are receiving the treatment and how much was paid. By my quick math, maybe I'm wrong, but I think it's $50,000 per person per year, per patient per year. When you just quick division, $77 million and 752 patients, individuals who received the treatment over a 2-year period. And that's a number right there that should have made somebody ask, is it, I mean, I don't know, is it really that expensive? Maybe it is. Maybe that's really what we have to pay to get the results we want. But I would think that just something as quick and dirty as that would raise a red flag. So I'll stop there, Mr. Chair. Thank you very much.
Mr. Noble.
Mr. Chairman, if I could just respond to that. You know, again, if there had been a budget for this program for the payments, and somebody was monitoring that, I think they might have noticed. But again, you have to always say and ask, is the large amount we're paying, is it tied to face-to-face encounters? And actually, a lot of opioid treatment programs have been based on face-to-face interaction. The old model of methadone treatment was the client had to come in and get the methadone and then take it in front of a health provider. So it is possible that an opioid treatment program that follows a face-to-face encounter approach would result in these large amounts of payments. The disconnect here is, as I've said and I repeat, that they decided to say to some clients, no, you don't have to come in. We will give you the bottle of pills, and you can take them home, and then you can self-administer these. Now, the tribes actually can go back to the old system and say, no, client, we're not going to give you the bottle of pill. You have to come in. That will be an encounter, and they will get the $455 payment. That was the disconnect that we didn't see, that the department didn't see. So looking at the numbers alone will not necessarily tell you there is an issue, because the issue is embedded in the distinction of what is an encounter rate payment. It requires the patient to be present in the clinic, and that is what did not occur. I don't know what the tribes are going to do to resolve this problem, but they do have the option to going back to the model of everybody who's on Suboxone, and that's the narcotic treatment drug that we're talking about here, not methadone. You have to come in to get your daily dose of Suboxone, and then the tribes can charge $455. That'll be their choice.
Senator Klein.
Thank you, Mr. Chair. And you've actually just highlighted precisely what I was going to speak to. There's been bewilderment in this room about how we got to this spot, illustrated most acutely by your example of holding up your blood pressure medicine and wondering why would somebody...
How did you know, Senator, that was...
You could tell. Why would somebody pay me to take this at 8 o'clock this morning on my own? But I think a possible explanation, not an excuse, but an explanation, is that the treatment protocol for Suboxone, buprenorphine, has changed over the last 10 years. And it did start with a methadone model, which is a highly regulated model, where individuals do have to come in and be observed taking their dose each day. That is a legitimate encounter. We watch them take the dose. Over the weekend, often they're not staffed, so they're given 3 doses over the weekend, and you could argue there's a legitimate oversight function there that could be billed for. The treatment model for buprenorphine appropriately has changed over the last 10 years, developed so that now it is appropriate to see someone in the clinic initially, launch them on a program, and discharge them with a plan. Clearly, the reimbursement model has not kept pace with that. The reimbursement model is still a methadone-based model. So perhaps an explanation for how this developed, if not an excuse, is that the payment model needs to match current practice models. And certainly, we should not allow the tribes or anyone else to go back to the methadone-based billing and counter form that you just described. That should be up to the department, or if necessary, we as legislators to prevent that. The other point I would make, I was right on target with Senator Kiffmeyer's comments about what are we doing with non-tribes, both in terms of equity and dollars. If we are going to say this is not a legitimate fee for the tribes, it is absolutely not a legitimate fee for opioid treatment programs in the general public. And even though the amount in dollars is quite a bit smaller by a factor of 10 or 20, I would anticipate that the volume of patients is quite a bit larger, so that the total dollar amount may actually be similar or even more. So we should certainly transform payment models for non-tribal payments as well. And then I just wanted to say, Auditor, that the report highlighted it was an excellent report, and it highlighted a number of significant concerns for me. Number one, when you went back and tried to find accountability for who made these decisions along the way, you were really not able to find somebody there, and that was extremely distressing to me. An inappropriate, clinically and financially inappropriate decision was made, and we can't sort of find the person who made it, and no one's sort of willing to do that. And then after the fact, the blame shifting onto the tribes, when they had sort of solicited DHS repeatedly to see, are you sure we're doing this correctly? And then when told they were not, the sort of disrespectful way in which they were treated is alarming. And now it does seem as though the initial person who sort of saw this and sent a letter to the tribe saying this isn't a legitimate fee was Commissioner Tony Lurie on May 1st, 2019. Obviously, we've been now on our second commissioner since that time, and I give the new commissioner every opportunity to sort of make this right, but hopefully we can appropriately bill for opioid treatment programs in the future, as they are an essential program for health in our state, and also repair and respectfully replace our relationships with the tribes.
Mr. Nobles.
Thank you, Senator. Appreciate that.
I have a couple questions. Oh, Senator Rest. Yep, Senator Rest, go ahead.
Thank you, Mr. Chairman, and Mr. Nobles, I have more comments than observations than questions. It does seem to me that if you had been doing these deep dives in various programs, it will have become program audits, not financial audits. There would have been in a financial audit, a management letter or something. But I think it's clear that the dysfunction in this particular activity is showing us that silos in government where people don't talk to one another in the same agency or wash their hands of responsibility is no more clear-cut than in this example. And I know that Senator Benson and perhaps Mr. Chairman, members in the House are looking for ways of the Department of Human Services being organized in a way in which Representative Liebling, something like this doesn't go on for years. It would be impossible for it to go on for years. And I certainly hope that the governor and the commissioner are going to present some alternatives to the legislature, because if they don't, then we will do it for them. And it might not, our system or reorganization, because we are not experts, none of us here, might not be the best. and that it would be much better service to the people of Minnesota if the experts in the Department of Human Services and/or other organizational experts that they might consult would come up with a better program, better protocols. I mean, you could spend 12 months a year on the single audit. And it's not that mistakes are not made. We know that an agency may have a clean audit or maybe no findings, and 2 months later, there was a $1 million embezzlement in the Department of Revenue. I mean, it does happen. I just think that this is the prime evidence for the need for meaningful, purposeful, thoughtful, non-blaming reorganization of the Department of Human Services. And we might well look at other agencies that are so huge that they have an organizational chart even as long as the one you're showing us there. Thank you, Mr. Chairman.
Mr. Nobles?
Thank you, Senator.
Senator Kiffmeyer, and then Senator Cran went off the list, and then he went back on the list. So we'll go with Senator Kiffmeyer.
I think the importance here is to make the distinction about responsibility versus legislative auditing. There's a big difference. And so DHS, the governor appoints his commissioners. They're the executive branch, and the executive branch has the responsibility to implement, to know the laws, to comply with the laws, to put the systems and processes in place that they need to do that. That's just the job of the executive branch and the commissioners. They have a duty and a responsibility. The legislative auditor does auditing, but does not have that same responsibility. And so if it took this much time to do that, I just want to be careful that we don't blame the messenger, Mr. Noble. So the reason why we have the data that you could point out, that was pointed out here, is because you did that 4-month deep dive in this particular area upon a problem arising. And that is often what the legislative auditor does, is that an issue comes up and then it helps you to focus, because to do it in everything and every way, you just couldn't. So you kind of use a barometer, a measurement that says, hey, look here, something has surfaced, and that's very legitimate. I think, too, the biggest concern for me is what others might be out there, and especially because one person who has, brought this out in another area was talking about, her being blamed for it. And so I think it's important, a situation that we do that. I think one of the ideas that I had was the commissioner being required to approve any policy changes in writing and with supporting documentation, because I don't think in these kinds of things where you have payments affected and other things like that, that should be down that deep. Those are things that are the purview and the responsibility of a commissioner in regards to policy direction and to do that, and it should rise to that level and not be down there. And I would appreciate your response or any suggestions, whether today or another particular time. I think, Senator Rest, you bring out a really good point in regards to sometimes when I think of a commissioner in this situation with an agency that is this huge, the management of that is absolutely become, I think, unwieldy and maybe too much for any one person to be able to exert that kind of level of understanding and detail and following through with that. But again, nonetheless, we're in this situation today, and I think I appreciate the commissioner's response, as I saw here in the letter already. That's what I always look for, as a commissioner says, yes, this is what happened. Yes, I'm going to take action, going to follow through with that. And Mr. Chair, are we having the commissioner address us?
Yes.
I'd really be looking forward to having the commissioner, after this amount of time that we've done, to have her respond and get her thoughts on this.
Senator Cran.
Thank you, Mr. Chair. And I appreciate the work that the Legislative Auditor has done, and Mr. Nobles, the work that you've done and the conversations we've had in the past. Here we are again in talking about another program which is, hit the news, or it seems to be the drives a good significant or a good portion of your work. But I would caution everybody from the perspective of, we keep using the term broken, failed, dysfunctional in the process. And that, much as I respect the Office of the Legislative Auditor, a recommendation for more legislation, which is really to only address the symptom of a delivery system that isn't functioning as we want it to. And when I look back at it, and I'll certainly be interested when Commissioner comes up as well, is that we really need the governor to approach or take this, because, and it's not about where I think where there's some terms in here, continuous process improvement. We have many examples today, and Mr. Nobles has been involved in many of them, and pick MNLARS or any of the programs that we look and we talk about that they're broken. And I keep arguing they're not broken. The system is only designed to produce that type of result. And so unless we're ready to wholesale change and it's not because of people, not because we don't have good people, but we have a process that has no naturally occurring corrective action for when we get it wrong. And when MNLARS fails or appears to fail and is an inconvenience, yeah, you may or may not notice it. I think people do. You may or may not notice when it stops functioning in other parts of your life. It's not transparent to you. In these areas, these are some of the few things that escape the cone of silence that make it out into the open, and people discover that, boy, I just don't like the way it works. But I don't see any interest from anybody in this legislative process or the governor at this point to really tackle it. We can talk about we want to be better and all those things, but we have in the world of Department of Human Services, we serve the elderly, our disabled, and children. The primary function of government, and it's life and death. It really is. And so for me, that's the approach, and everybody who knows may understand Senator Cran is a broken record. I know it, and I've been there, and I understand the life cycle of its business process. We have to put in a structure that teaches everybody and continually educates them about why their job exists and what is their service or their product and who's delivering it. Most have come into this process never working in the industry they oversee or regulate. How can we expect them to make decisions that are impactful or meaningful? Because they've never done your job, or they've never done the job who's providing the services across the board. So that, to me, is what I would like for everybody to understand and focus on. Unless we work on changing that process, nothing will get better. We'll feel better because we're going to have new legislation and we'll get to beat our chest, but it won't fundamentally change anything. And the things that we have coming, I'm a baby boomer, right? You look at the world of health and human services, we got a lot of real challenges. And so, to me, those are the things that we have to do. Now we've got a life cycle of our new generation, their work environment. We're not going to have institutional knowledge that's retained in an agency to understand even what the heck those rules were 6 years ago, more or less 10, 15, 20 years ago. And it's going to be really important. So we are going to have to fundamentally change how we deliver services. And that means doing something drastically different. And so, to me, that's what I would like us to focus on. And I know most of you have heard me before, but if we don't start at some point, we'll never be able to change that process. It's going to be a 10-year process. And I can tell you, I've worked with people on the front lines and the investigators in DHS and everybody's desperate to be included in the process. I think somebody mentioned experts in the field. Our experts in the field are the ones delivering the services. Then we have experts in our agencies. They feel left out and lost. They don't have any opportunity to go out and have a food chain or have a chain of command up to management that is valuable. So those are the things that I think we have to focus on. What are we going to do wholesale and systematically different than we have in the past? Because we get really comfortable about redesigning our job. All we do is make it more uncomfortable, more laborious for the people who deliver our service, and it takes them away from actually providing the service that we did or that we were hoping for. So that, to me, I know it's the Cran soapbox, but I'm telling you, it's the primary focus in what we have to do to make significant change, and it matters, because in this world, it's life and death. So thank you.
Mr. Nobles.
Mr. Chairman, I think you still had a couple of questions, Mr. Chair, so let's have those, and then I know you want to have some time for the commissioner, so.
Mine were more specific. looking both below and above. So I think Senator Rest has brought up at previous points that we developed internal controls, that we have this internal control system, we get the internal control bulletin. So I'd like to know what happened. I see there's a 3-month gap here where there's a flurry of activity in February and May. So was the agency doing an internal investigation? What was happening? What was happening there? Is there the systems? And this is maybe going to what Senator Crandall is saying. Were the systems that were set up for internal controls? That's when the catch occurred. It didn't occur in the Carlson administration. It didn't occur in the Ventura administration. It didn't occur in the Palenti administration. It didn't occur in the Dayton administration. But sometime between February and May, something happened so was that the internal control systems that were based on previous audits that we've had that's saying that these agencies have to develop some internal structure? That's question number one. Question number two is above you and the federal government. So the tribes have a relationship with the government. That's a government to government. And this is federal money. So where's the federal piece of this? Is there federal guidance? Is there federal involvement? Where did you find federal memos? I don't see anything in here about that. So we may not be able to do much as a state.
Mr. Chairman, then starting with your first point about internal mechanisms finding this. Actually, and again, kind of reflecting on Representative Liebling, I hate to admit it, but I'm afraid I have to say that it was more by chance than design that this came to light. It happened because Red Lake asked this individual in the department, who, as I've illustrated with my taped together organization chart, is way down here. Well, Red Lake sent him an email. And as I said, they wanted to know, can we get the encounter rate? He said yes. There is an official at the department who is the department's Indian liaison officer, Vern LaPlante, and he saw that email and he said, I'm not so sure that that answer is correct. So he said to Red Lake, you better wait until you get an official response. Now, had Vern seen, Mr. LaPlante ever seen other emails that Mr. Moldenauer had sent out saying the same thing? I don't know. All I do know is that he saw that one on February 12, 13, and he said, I don't think that's the right answer. So Red Lake, you better wait while we really talk about this within the department. That's what triggered this flurry of meetings, emails, discussions, where then people came forth and said, no, we have a policy statement that says you cannot pay an encounter rate unless there's a face-to-face interaction between a client and a healthcare professional. Now, why people had not raised that question before, I don't know. All I know is that around that early February timeframe, this gentleman raised the issue. And the result was that they decided we cannot do this. It's not authorized. It's not in compliance. And what happened between that period of time and when the May 1st letter went out, all I can see is a lot of discussion, concerns, debate. It really kind of opened things up within the department. And then the folks over in the Medicaid unit got involved, people in tribal relations got involved, a lot of people got involved in a discussion. And they came to the conclusion, actually, they came to the conclusion much earlier than May 1, and we have some documentation of that. Why it took them till May 1 to communicate their result to Leech Lake, White Earth, and Red Lake, I don't know. But I think that gap in time is unfortunate. It's also unfortunate that the department didn't put the control in to stop the payments for that period of time as well. So, Mr. Chairman, there are a number of gaps of time that are inexplicable. The department didn't notify the legislative auditor until July. They knew in February that they had been making unauthorized payments. There's a law that says when a state official finds any evidence of unauthorized, illegal, inappropriate use of state resources, money or other resources, they have to promptly notify the legislative auditor. February until July is not prompt. So there's a lot going on in the department that I can't explain. You'll have to ask them. As to the federal government, they're missing because they're missing. I don't know why they're missing. We've talked to them. What they're going to do about this situation, I don't know. But one of the first things we did, because this is 100% federal money, this is Medicaid money, and because frankly, initially, not after we conducted our review, but initially, you do ask questions like, is this fraud? You have to ask those questions. Auditors under audit standards are required to ask those questions. We didn't find it, but we had to ask the question. But we knew that we didn't have jurisdiction. So we went to the U.S. Attorney and we said, we have this indication of unauthorized payments of Medicaid money. And we want to notify you of this because you might want to conduct your own investigation through the FBI and through the Office of Inspector General for the Department of Human Services. We met with them, and they have that prerogative, they have that jurisdiction. If they want to pursue that investigation, they can do that. But had they done that before? There's no evidence of that. There's no evidence of CMS, the department that oversees the Medicaid money, having questioned these payments. But again, I just want to go back because I really think it is so important that if you just look at the numbers, and maybe this was the situation with the federal government, if you just look at the numbers, the payments, that alone doesn't tell you that they're unauthorized. You have to have an audit trail that says that payment on that day to that client was for a home administration, not for that client to come into the clinic. Because if the client came into the clinic, it's an appropriate payment. So you need the audit trail, and you don't get the audit trail because for many years it wasn't there. And after it was there, it's deep in the paperwork of DHS. That's probably why the feds didn't know about it either.
Thank you, Mr. Chair, members of the Commission. I'm Jody Harpstead, and I serve as the Commissioner of the Department of Human Services. Thank you for the opportunity to address the report from the Office of the Legislative Auditor. I'd also like to thank Legislative Auditor Jim Nobles and team for their work and professionalism and their special review of this issue. And I would most especially like to thank Chairman Jackson of the Leech Lake Band of Ojibwe and Chairman Fairbanks of the White Earth Nation, who've been patient and gracious beyond expectation as I have met and consulted with them since I started 57 days ago. There's nothing more important for the Minnesota Department of Human Services than to be trustworthy to the people of Minnesota, trustworthy for those we support to live in community, and trustworthy to the taxpayers whose resources were given to offer that support. The Legislative Auditor report on payments for tribal medication-assisted treatment programs concludes, quote, "The department has created serious financial and legal problems for the state and the tribes, which will be difficult to resolve," unquote. That is true, and that is not trustworthy. The issues addressed in this report from the Legislative Auditor make one thing very clear. The Department of Human Services gave erroneous guidance to White Earth Nation and the Leech Lake Band of Ojibwe, and thus department data over the past 5 years estimates it overpaid these tribes for medication-assisted treatment programs by over $29 million. An issue with this billing practice was not identified until earlier this year, when the Red Lake Nation inquired about the same treatment program, and Vern LaPlante, Tribal Relations Liaison and long-standing DHS employee, stopped the process to question the guidance. The guidance that was given to tribal governments was wrong, and it's impossible for us to serve Minnesotans in a trustworthy way if they believe that their interactions with DHS could leave them on the hook for tens of millions of dollars. I'm especially sorry that this error in the department unfairly affected the tribal nations with whom Governor Walz and Lieutenant Governor Flanagan are working to restore trust and rebuild our government-to-government relationships. Relationships important to the department, our state, and recognized by Governor Walz in Executive Order 1924, noting our state's commitment to meaningful and timely consultation, coordination, and cooperation. Based on the OLA report, this is clearly not an error caused by one individual or one commissioner. I appreciate that might be frustrating to some who might be wanting to get to the bottom of this and take action against the culprit, for all of us to feel that we have taken care of this. Instead, since the Walz-Flanagan administration uncovered this error earlier this year, we have been setting to work to correct the problems in the department, systems and processes that allowed such a costly error to take place, and to ensure that we have protections in place for our partners in serving Minnesotans. The Legislative Auditor report also states that, quote, every well-managed organization designs and implements procedures to ensure that the organization complies with its legal obligations and internal policies. Organizations call these procedures internal controls, end quote. Amen. Couldn't agree more. I have heard a lot since my time at the department thus far about the importance of institutional memory, some of which we're losing as our baby boomer staff retires, ensuring that there's cohesion and consistency across administrations. What we have here with this system is an example of the dangers of institutional memory, when decisions are accepted without review, challenge, or interrogation for years at a time. Operating a large, complex payment and billing system on the goodwill of seasoned managers with institutional memory and not on well-documented internal controls, as you said yourself, is a thing of the past in both the private sector and the public sector. We have had a stronger process in the multi-billion-dollar processes of the department's healthcare payments, where flaws like the tribal MAT overpayments have not occurred for the most part in services that make up the vast majority of annual spending by the department, though they have not been immune from problems. The handling of other federal Medicaid programs has been softer and less well documented and disconnected from the federal expertise in our healthcare administration and needs to be sharpened. The really good news is that we have the very expertise we need to remedy the situation inside DHS under the leadership of Deputy Commissioner Chuck Johnson that has been applied to other processes in state government over the past 3 to 4 years. You will all remember when St. Peter Hospital and Anoka Regional Treatment Center were in the daily headlines 4 years ago. When I started this fall, I met a proud, cohesive senior team eager to show me their quality metrics and low incident rates after using state-of-the-art Six Sigma quality improvement processes to clean up their processes and procedures. Our Office of Continuous Improvement, filled with Six Sigma green belts and black belts led by Jeff Swanson, was dispatched to assist the Department of Health last year in shoring up the process to prevent elder abuse. Our Health and Human Services legislative leaders have all seen and admire our Office of Continuous Improvement's diagramming and redesign of the Inspector General's process for child care investigation this year, which was also featured in the Pioneer Press this past weekend. And so last week, I sent an email to our senior management team across the Department of Human Services to initiate Operation Swiss Watch, as in humming with the precision, detail orientation, and flawless execution of a Swiss watch. Our Office of Continuous Improvement is recruiting subject matter experts and green and black belt process experts throughout the department to come together to get to the root cause of the tribal MAT overpayment issue and each of the issues we have uncovered and disclosed in 2019, to map how decisions are made and by whom, and to propose a tighter, well-controlled, documented process for moving forward that accomplishes the accountability the department needs to be trustworthy. We've imagined, for example, that when they complete their work, both our program administrations and our Medicaid director will have to sign off on all new program payment decisions before our finance division will disperse funds toward those payments. A triple-checked, permanently documented, accountable process that we can better track and control. In addition to these improvements, we need to ensure we're getting ahead of the curve, actively identifying and mitigating known risks before we find out about a problem through an overpayment or an audit. Our Chief Compliance Officer Shireen Gandhi and her team have developed a process that requires us to create plans to address known risks or areas of concern, such as brand-new programs or computer systems, on an ongoing basis. We're rolling out that plan right now as well. This is another critical step in developing and maintaining a culture of compliance, internal control, and continuous improvement. I'd like to add that we also have several openings, as you know right now, some for assistant commissioners, and in addition to looking for people who are subject matter experts and who have an interest and understanding of policy, we are adding extra points to any candidate who has a management track record in a large organization, because I think that is one of the key things we need to shore up the culture and the processes and systems in the Department of Human Services. Returning to the Legislative Auditor's report, our responses to the 3 recommendations. Recommendation 1, I have already described our proven approach to continuous process improvement that we'll now apply to our payment and rate-setting processes. I have confidence that this approach will, over time, make those systems and our department stronger, more reliable, and more accountable every year going forward. Recommendation 2, in regard to tribal payments for medication-assisted treatment, we believe the law is clear. We have an agreement to contact CMS together with White Earth and Leech Lake to allow those tribal governments to hear confirmation from CMS along with us that the payment of the tribal encounter rate is not appropriate for these treatments. Next, we will follow our statutory duties to give official written notice to the tribes of the specific dollar amounts of any overpayments, starting a 30-day clock during which they have an opportunity to appeal having to repay the funds to DHS to an administrative law judge who can make a recommendation for the resolution of payments. Recommendation 3, the Legislative Auditor's report states, quote, the legislature should consider enacting exceptions to the law that require the Department of Human Services to recover payments to providers that result from department errors. Many others have said it would be patently unfair to ask the tribal nations to repay funds they accepted on erroneous guidance from DHS, and that the state has more capacity for absorbing these funds through its long-term forecast than the tribes. We would be concerned if a solution harmed services to other Minnesotans. We do have such a statute, actually, on the Minnesota books in the case of cash assistance programs like General Assistance and MFIP, wherein we're not allowed to cover refunds if there's a department error, unless a reasonable person would have understood that they were being overpaid. I hope that the legislature will consider this. I am as tired as all of you about reading about problems in the Department of Human Services. Though I'm also looking at each of those problems as a trail marker pointing to another process control step that will prevent future problems when put to rigorous examination. If there's another silver lining in this situation, it's the stories I heard in recent government-to-government consultation with our tribal nations as we were discussing this knotty problem. May I ask the question that's been on my mind all day? Did these treatments work? Without hesitation, tribal leaders told stories of pregnant women on these treatments giving birth to healthier weight babies and the hope that that brings for their futures. I apologize to the White Earth Nation and Leech Lake Band of Ojibwe for the misinformation that has led to the current situation, and I hope that the Minnesota legislature will work with us toward finding a solution. Thank you.
Any questions, members? Representative Liebling.
Thank you, Mr. Chair, and I'm sure there will be a lot more discussion about the solution as we go forward here. But Commissioner, do you know, does the current law require all or nothing, or is there room for some kind of negotiated solution? And if so, who would be doing that negotiating? If this is just a special situation because we're dealing with sovereign governments.
Commissioner.
Thank you, Mr. Chair. And Representative Liebling, as I understand it, both state and federal law have requirements that require us to go and attempt to recover the funds from the tribes. The steps that would happen are the ones I laid out. After we talk to CMS, we need to send a letter to the tribes explaining the problem and giving them an opportunity to appeal to an administrative law judge. That judge has an opportunity to come forward with a recommendation for a solution to the problem. I don't know quite how wide-ranging that judge's scope might be, but that's one step that could come up with a solution to the problem. Beyond that, I do think because of our read, and we've had others agree with us, that the state law certainly currently requires us to continue to try to recover from the tribes, we would need some kind of change in law not to do that.
Senator Cran?
Thank you, Mr. Chair. Commissioner Harpstead, I think you were in the room when I gave my comment before.
I was taking notes.
You also talked about the quality improvement, the Swiss watch theory and analogy. I like that. I like the beginning of it. But what I didn't hear in there is taxpayer. How am I going to go out and understand the business process of the entire life cycle of how we work with our providers? And so, again, those that actually deliver our service. Because the challenge that we have, and you understand it, the government delivery vehicle, which is all those we count on for our critical services, has an ecosystem of its own. Supersedes the legislative body, supersedes the executive body, because they know you and I are temporary. And so what I'm looking for is and I'm a willing partner, and I want to work with you and everybody across the board to figure out how we're going to work and what are those fundamental steps. I want your staff in the offices. I want them actually out doing the jobs. You mentioned elder care and that we had a great solution. Well, in our mind, in our world, in the limited criterion we measure ourselves on, maybe. But if you're looking at the stats and the criteria and you're actually talking to the people out in the field, that's not actually true. And so I want a customer or our citizen-focused program which allows us where we create a training cycle where every one of your staff is trained at the lowest level in which the industry and you oversee and regulate. I actually want them out there for a period of each time of the year, because if you're willing to make rule and policy and process and actually live by it yourself, then that's when we start to really gain that trust. And I think only then will we complete the life cycle and the continuous life cycle of how that process evolves and who's delivering our services. More critical today when we're forecasted to have a shorter lifespan of our staff, and that's changing for everybody. But we're going to be inserting people in this process at all different levels on a more frequent manner. We're going to have to perfect that life cycle. And again, we have a bigger battle because it doesn't naturally, no corrective action naturally occurs when we get it wrong. In the private sector, it happens all the time. Individual level, business unit level, product level, all the way up to the corporate level. It occurs or fixes itself. In ours, we just don't have those things. And I have a unique career experience that puts me in that position that I think we can do well together. And I think that's when change becomes investable and you can earn trust with the legislative body. And then we can have an honest conversation about funding. So I want to know, again, customer focused, how are we going to create that and change that life cycle? Not create more reports and more burdens on the people who provide the services for us, because we're really good at that. We are. But it's typically internally focused and doesn't really touch the people and the services in which are critical to the DHS service levels or who we serve. So, any comments on that? I'd love it. How we're going to do something new and innovative.
Thank you, and I think that applies in no situation more importantly than our attempt to deal with the opioid epidemic. I'm eager to talk with Senator Klein and pursue some of the line of reasoning he had around how we treat the opioid crisis today, how we should treat it going forward, and then how we should pay for it. And things have changed in the many years that these processes and systems have been in place, and we need to make sure that whatever we decide to do next matches with current treatment protocols that we know work, and then figuring out how to pay for them. And I'd be very concerned if we just shut off additional payments in this space and not have any idea what we're doing medically to the people who need those treatments.
Senator Klein.
Thank you, Mr. Chair. Thank you, Commissioner, and thank you for your heartening comments. Most deeply felt your apologies to the tribes for the misunderstandings that occurred there. I think that's a very promising start, as you say, 57 days in, so thank you. Thank you for your concern about hiring vice commissioners who have management expertise. I also think that's going to be essential to getting the results that we want, and your commitment to transparency. What may be hidden in the flat rate figure that we got for how much this cost was the fact that we incentivized something that required a minimum of effort. And in any healthcare delivery system or in any system, you're going to start getting a lot more of that once it happens. In my world, when we pay people to put people in hospital beds, we'll get a lot more people in hospital beds, and we'll have to build more hospitals. In this case, I wonder how many people were placed on a Suboxone treatment program because it was highly remunerative. And those are numbers we will never know. Medication-assisted treatment is extremely effective in the right cases where it is appropriate. It is not at all effective in people who have an only marginal indication for it. So as I have discussed with you previously, I'll be looking forward to having a discussion with you in the coming years about how to change healthcare incentives altogether so that we incentivize quality care to the right people and don't incentivize increased production and increased use of services, which in this case likely did occur and may have caused harm.
Thank you. I appreciate that you are working with us on the Blue Ribbon Commission and asking those questions.
Senator Kiffmeyer.
Sorry.
Thank you, Mr. Chair, and Commissioner Harpsted would agree that your comments are well received. I would say, though, it's so easy sometimes to turn to the legislature should do something also, and I think the same criteria should apply. We should know that it's beneficial before we take those actions, because I look at this, and I think you've responded to this, and has been pointed out, this is a management issue. This is about managing the agency, managing the office, managing internal controls, all those kinds of things. And I think to have you turn your focus on attention in that kind of managing the things that you've mentioned are very good. A practical question I have, which I brought up in the beginning, was the fact that the tribes were given this type of payment system, non-encounter, but so were non-tribal. So could you comment in regards to what if this is the decision you've made for non-encounter for the tribes, what about the non-tribes and their encounter as well, whether it's smaller, maybe a larger quantity, but a smaller amount? Don't really know even about that at all, perchance. But could you comment in regards to your intentions in regards to the non-tribal and making sure that we are fair across the board?
Commissioner.
Thank you, Chairman Hansen and Senator Kiffmeyer. Only a little. I have to tell you that I've spent my time since I came understanding the tribal payment system and how we were doing that. And I think you know that the Legislative Auditor process this last couple of weeks has been compressed. We usually have a longer time to see the report and a longer time to respond to it. And so I've asked my team to go back and examine the non-tribal payments and how we do that and how that whole process works. We expected to be answering questions about the tribal payments, not the non-tribal payments. Now that that's in the report and in a recommendation, we have to go back and examine all of that, dig it up and understand what's going on there before we can really be clear about that, and we will. And in that process, we'll try to understand what makes sense to do in that case as well. I've heard a few people initially be very concerned about creating chaos in our state's approach to treating opioid addiction. And so need to go understand what that means and how do we do fair while still making sure we're treating people who need it.
Thank you.
Any other questions? Representative Kanish-Padin.
Thank you, Mr. Chair, and thank you, Commissioner. I just noticed something on the bottom of page 12 of this report where the employee from DHS asserted that there is a legal basis for DHS to pay tribes the IHS encounter rate for clients to take opioid treatment medications at home. And I'm wondering if you have any knowledge or where that legal basis comes from.
No, I've seen that quote in the report as well, and I don't believe anyone else in the line of management in the Department of Human Services agrees with that interpretation.
Representative Kanish-Padin.
Thank you. And then on page 11, there was another statement that DHS staff confirmed that the practice of paying MAT providers for doses of medicine clients took at home has been in place for non-tribal providers for many years, since the 1990. So when we talk about the institutional knowledge or practices, or this is how we've always done it, and we can't find that kind of documentation.
Right.
Is that the sort of thing that you will be looking for to create those sort of safety nets for this sort of practice? And do you think that, that's my question.
Absolutely, yes. And so our expectation is when there's a new procedure that hasn't been done before, or we haven't paid for before, that someone closest to that particular service would be making a decision and signing off. Someone, if it's federal money, Medicaid money, our Medicaid director would sign off, and then our finance, our CFO would need to sign off before the bills begin to be paid. I think. Now, we are about to put Jeff Swanson on this entire analysis of the process, and he'll come forward with a set of recommendations on the very best continuous process improvement approach that we should be using. So we'll see what his report tells us. But it would be something like that, where there would be 2 or 3 sign-offs on every decision, and then the people who write the checks would not start writing checks until they had seen that the right approvals were in place.
Any other questions? Thank you, Commissioner.
Thank you.
District 3 Representative Leroy Fairbanks of the Leech Lake Band of Ojibwe. Who may have left the room for. Okay. Welcome.
Thank you.
If you could state your name for the record. Oh, Senator Rest.
Before they begin their statements, about their statement. I'm just curious about why there's not a formal statement printed in the document, since they are primary entities that are involved. We often find that.
Mr. Nobles.
Mr. Chair, Senator Rest, we reached out to both tribes, to the tribal chairs. We did want to meet with them. We did want access to interview people at Leech Lake and White Earth. We wanted documents, and it was their decision to not participate in our review. I did brief them in advance.
Proceed. Welcome.
Thank you. Good afternoon, Chairman Hansen, Vice Chairman Curran, and members of the Commission. My name is Leroy Staples Fairbanks, and I serve as the District 3 representative for the Leech Lake Band of Ojibwe. Thank you for allowing me the time, for allowing me to testify here today on behalf of Leech Lake Band. We are thankful that the Office of Legislative Auditor has released its report on the issue of billing rates for tribal medicated assisted therapy programs. We have had the opportunity to discuss the report with Mr. Nobles and appreciate his time and attention to detail. We look forward to working with the Department of Human Service and Legislature to come up with meaningful resolution to the matter that respects the sovereignty of our tribal governments and helps to continue to address the ongoing opioid epidemic in our communities. The Leech Lake Band's position from the outset has been that we will not repay this money because we are not at fault. That remains our position to this day, and the Office of Legislative Auditor's report confirms that we are not at fault. We know that simply demanding the tribes to repay this money will not reach a meaningful resolution nor address the ongoing crisis our communities face. Seeking repayment in excess of $14 million from the Leech Lake ban will result in catastrophic cuts to important services and programs needed by the most vulnerable members of our community, and will ultimately only serve to exacerbate the opioid epidemic in the long run. We are committed to working with the Department of Human Services and the state of Minnesota to find a solution that does not negatively impact our most marginalized and needy citizens or require the ban to repay the funds it should not have to repay. Looking ahead, the Leech Lake ban would also strongly support Recommendation 3 from the Auditor's Special Review, calling upon the legislature to consider enacting exceptions to the law that requires the Department of Human Services to recover payments to providers that resulted from department errors. As the facts outlined in the report clearly demonstrate, the current law automatically requiring repayment removes financial accountability from the department for their own errors. Even worse, it requires the state to unfairly punish the very Minnesotans who partnered with the department in good faith. This report is a step in the right direction, as it rightly notes the Leech Lake ban is not at fault and appropriately outlines how we got to this juncture. We look forward to the next step in this ongoing dialogue. Again, thank you for the opportunity to address you today, and I'll be happy to answer any questions that you may have. Miigwech.
Members, any questions? Thank you.
Miigwech.
Mr. Nobles.
Mr. Chairman, I'd be happy to, in light of the Commissioner's response and the officials from Leech Lake, if there are any other questions you want to direct towards me. Otherwise, I'll simply thank you all for taking time to be here today. I think we've gained an understanding that this is a very complex, serious issue, and so I'm sure that there are going to be many more steps ahead that we will need to go through, and certainly the Office of the Legislative Auditor will be prepared to help in any way we can.